Thanks so much for joining me on the Slice of Healthcare podcast. How are you today?
I'm well. Thanks for having me, Jared.
Absolutely. I'm excited for us to chat. You and I were talking a little bit. I'm originally from the Boston area, and that's where you are, and that's where Kyruus is, right? So it's I do miss the area a little bit. I'll probably be up there this summer and hopefully this fall for the HLTH conference that's going to be at the Boston Convention Center this year, which is pretty cool.
It is right at the peak Massachusetts Board of Tourism time. So it's a good time.
And I'm thinking we'll be in a much better spot around mid to end October. Well, we better be too. It'd be bad if we weren't. So let's hope.
Indeed.
Well, I'm very excited for us to chat today. I think we should dive right into it. I'd love if you could give the audience a little bit about your background, and then we'll talk more about your role at Kyruus and some of the interesting topics that are kind of going on around healthcare right now.
Sure thing. So my name is Erin Jospe. I'm an internist by way of background. I've been in the Boston area now for I think about 25 years now. Did my training up here, and I've been, after a very long career in practice, I moved over into the health IT space. And now I'm proud to say I've been with Kyruus in the role of their chief medical officer for the last 4 years.
And just for the audience, I'm sure many of the people listening to the podcast, have heard of Kyruus, but could you just quickly give us, I guess, that quick description of the company, what you do, kind of how things work?
Sure. So Kyruus is the leader in provider search and scheduling solutions for healthcare systems. And what we really believe at our core is that we want to help enable everyone to be connected to the care that they need and in the way in which they wish to receive it. So we're really about creating patient access, and we believe that patient experience begins with patient access. So we leverage all different types of provider data to help enable consumers and patients and other clinicians to find the providers of care that they need. And so that's what we do. And as of yesterday, we announced our acquisition of HealthSpark, which does very much the same work, but in the health plan space. So it was a natural joining of very similar cultures with very similar philosophies about the importance of patient access and how that really drives member or patient experience. So now we've grown very quickly and are really looking forward to making inroads in all of the different ways that people interpret what patient access could mean.
Congrats on the acquisition, by the way. That's a huge win for you and the Kyruus team. And for, I'm sure, just your ecosystem of customers and partners as well. Can you talk us through your role as chief medical officer? Because we talked a little bit about this when we were kind of just chatting before the podcast, how the role of a chief medical officer can really differ by the organization type. So I'd love to hear more. And then I guess if you could also follow that with the importance of a digital health company having a chief medical officer, kind of what that means.
Sure. So you're right. I think that chief medical officers mean a lot of different things in the health IT space. The way that I had sort of always seen my role very tactically was to help in prospect conversations. What is it that is clinically resonant? How can we make sure that clinical stakeholders at our prospects feel both heard and engaged and involved? One of the things I mentioned to you before is that I think in general, health IT often feels like something that's done to clinicians instead of for or with them. And so making sure that clinical strategy is one of the things that we lead with, and respect and involvement and engagement of clinical stakeholders within those decisions, I think is very important. More than that, though, I think there's the establishing those relationships with those stakeholders and carrying it through the implementation process. Are we really landing where we had intended to land? Are we using the patient experience as our North Star to ensure that we're making this both something of tangible value and ROI, but also making sure that we're really taking a consumer-centric approach to this, that healthcare is not just a patient in a room with a clinician. It's so many other people who touch them along the way, and making sure that they're involved in how this access strategy is really being brought to bear. And lastly, for me, I had the privilege of serving as a product manager in the past. And so being able to translate both what you hear people saying out in the market, but also being able to interpret and see around the corners a little bit, and being able to translate that back for our product and engineering teams is another really exciting part of what my job is. So it's kind of in service to those three pillars. At the end of the day, my hope is that I bring clinical strategy to Kyruus, and really thinking about all of the different ways we need to interpret what patient access really means, and to do so in a way that balances both the patient experience with the clinician experience as well. We don't ever want to be myopic in how we define things, and connecting everybody to the care that they need is really more than just a one-sided equation. It has to incorporate the business cases of the health system and the payer. It has to incorporate the clinical perspective, and it has to incorporate the patient experience as well.
Can we dive more into this topic and in focus of patient access? And can we put the lens of, I guess, the COVID lens on it, on how that's affected patient access, and I guess what Kyruus has been doing as a result of COVID to maybe either alter or stay on the same path in regards to patient access? Can you comment on that?
Sure. So I think, health system strategy needed to pivot on a dime, as the brick and mortar institutions closed, but care still needed to be provided. And so when I think about patient access, I really want to make sure that we're being broad in that term. How do we think about access to reliable, vetted information? Goodness knows we had quite a lot of non-vetted and unreliable sources of information during that time. So I think it's access to information. It's understanding what your care options are so that you can make informed decisions. It's how to surface that in a way that is accessible. And so accessible has to mean not just digitally. It has to incorporate many different types of outreach. It has to be done in a way that is an appropriate medical literacy level. It needs to be in the language that people wish to receive that information in. It needs to take into account other types of accessibility challenges. And of course, it needs to help move the needle on social determinants of care and those barriers to access as well. So really being able to use the pandemic as a motivator, as a source of momentum for how to consider a lot of those definitions of access really quickly and be able to pivot is a lot of what the clinical strategy, what my technical peers, what my customer success and account management teams all needed to kind of come together to do, to really present that kind of trusted advisory role to our customers to enable them to pivot really quickly. Certainly virtual care has had a whole new paradigm shift. Before, there were minimal numbers of appointments that were done this way. And now suddenly out of necessity, people were really thinking about how to best make care accessible in that regard, how to use their digital front door to present people with the information that they needed. So really using COVID as not just its own strategy, but helping to refine what else the goals of the health system were, to be able to attract and retain patients in general, but also just to recognize that there's a role to play in their communities as well. How to make sure that they are getting care to everybody, and to be mindful of what the digital divide could mean for everybody getting the care that they need.
Thank you. I appreciate that answer. I'd like to, before we start to wrap up here a bit, I'd like to focus on one more question. And please only say what you can say. I know there's certain things that you probably can't say, as is the case with any company. What are some of the things you're really excited about that Kyruus is doing? We're already into a couple months into the 2021. But what can you comment on that you're very excited about with what Kyruus is doing kind of moving forward?
Sure. So, I mean, I would be remiss if I didn't highlight that just yesterday we formalized our acquisition of HealthSpark, right? So when we think about surfacing provider data to enable people to make really good decisions about where they want to get their care, and to do so in a way that is consistent with their value system, wherever they may be over the course of their journey, recognizing that it's not just an access center, it's not just a web page, but now it can also be through a payer portal and website. That's really exciting. So being able to expand our definitions of where people can go to get information, to be able to book appointments right there, that's incredibly exciting. As a clinician, I would say it's also really exciting to help be assured that the data that exists about me that's being surfaced into the ether is really consistent. So everyone's getting the same message about what I do, what I'm capable of, and that I have a certain kind of autonomy and agency over what it is that's reflecting me. So I think that that's empowering for both consumers and patients, as well as clinicians. I will also say, I think, a mindfulness about social determinants of care, the inequities that exist today, the opportunities around mental health. Those are things that I personally find really exciting right now, because we can acknowledge how much opportunity there is and choose to embrace that and address those issues head on. So I would say very personally, those are the aspects that I'm most excited about. And again, just seeing how quickly we can expand our definitions of what access really means.
Thank you so much. And I just want to quickly again say thank you for joining me on the Slice of Healthcare podcast. And for the audience, the goal is to have you and hopefully other members of your team on the podcast again to cover all these different topics in health IT. But I'm glad that we were able to kick things off with this episode, and I'm excited for us to have those opportunities to chat again in the near future. Thank you.
Thank you, Jared. It was a pleasure.